Health insurance options when leaving employer. Hello all. In Q1 Q2 in 2021 I will be quitting my W2 job. I am planning for worst case scenarios for health insurance costs. If I keep my employer's insurance, it will be around $450. I am a late 20s male with no recurring prescriptions and healthy. I also have no dependents. Any options that take account savings or net worth, I will not be eligible. I also will be vagabonding for around 6 months in Argentina Q3 Q4 if that is a factor. My goal is to eat into my net worth as little as possible. I have some rental or dividend income from my portfolio, to cover some costs. Thanks for taking the time to read and appreciate any suggestions. Hope it helps anyone else in the future in a similar situation. P.S. I know 100% focusing on a true fast lane business before would be ideal, but I want to take the trip first. I'm on the forum and understand that's an option. It could take 3 to 5 years of full-time attention. I want to cross the trip off my bucket list before. The future is uncertain and may have more responsibilities then. Until I started looking, I had no clue how expensive insurance would be. It's the biggest expense, US specific. You may be able to buy a catastrophic Obamacare type plan if you are under 30, which is cheaper. There are also Christian ministry type cost sharing options, though they don't really promise you anything, so theoretically they may end up not paying for something like cancer. Hard to say, as it also happens with traditional insurance. There are also lots of unregulated ones on the internet, off marketplace. Rumors say that they similarly don't like to pay, but like to charge you a lower fee while nothing happens. My hope is that the coronavirus will be the last drop, and we will finally get Medicare for all. I appreciate the response. I am US based. It seems the best option will be looking into Obamacare options like the policy or not. If I can take advantage of it, seems like the best option. Thanks for the heads up on the options over the internet. I would rather go with a more certified company. If you are coming to Argentina, just hit me up. That or cheaper prices on the exchange. Once in a blue moon, I check the exchange prices, and since C0VLD, the one I wanted, went down by $40. To have close to what I have, I would have to pay $560 a month, and I'm single with no kids. I don't mind incorporating the cost in my expenses, but it's so crazy how much of a train wreck this is. Case in point. Truly. It's as if the universe was sending a signal. We've had the Christian Share on Me Christian Care for over 3 years now. Yes, they don't cover a few things like annual physicals, but they just paid for my wife's prenatal checkups, our daughter's birth, and so far, all her well-child office visits. When we signed up, it was about $400 cheaper than the next insurance option, Kaiser. Right now, it is about $300 cheaper than the next option, Aetna, for a family of 3. I would look into it if I were you. I think it less than $100 a month for singles. They do offer reimbursement options if you incur any medical expenses overseas, which should be a couple hundred in Argentina. Anyway, happy to answer any questions. I get mine through our local Blue Cross or Blue Shield franchise. A lot of good plans there. We have company benefits that we offer to employees, but we've kept our personal BCBS plan because we like it. You should look into plans like Christian Share as noted above by, or something non-secular like Cedar medical cost sharing. If you wanted to contract with a local direct primary care doctor in your home state, then that would be an option. Otherwise, depending on where you're living, an arrangement can be made with a doctor such as myself to do telehealth. It depends on your state, licensing, etc. Feel free to DM with questions. Thank you for taking the time to respond. Having a place to start looking is invaluable. Google just led to more questions. I like the idea of finding an arrangement with a doctor. I'll be taking you up on the offer for more details closer to next year. Also, and the case and point mystery is killing me. Sorry, missed your response earlier. Will do. Assuming the border is open, hope everyone had a good 4th of July, even the non-Americans. Hi, health insurance expert here. When you say keeping health insurance through your employer is $450, do you mean that is the monthly cost while you're employed? Or is that the cost to continue coverage when you lose your job through COBRA? In your situation, a marketplace plan, Obamacare or COBRA will be your best options. However, COBRA coverage only lasts 18 months, so if you're looking for something permanent, the marketplace is your best option. I have not personally looked into Medishare options, so I won't comment on that. I would forget about direct provider contracting. Good luck. Also, a direct primary care arrangement will be useless when you need any form of care that goes beyond an office visit. You will have no coverage if you need significant care like an elective outpatient procedure. Also, if you're going to be outside the US for a significant period of time, why purchase domestic health insurance at all? You should be aware that most health insurance plans specifically exclude health care provided outside the United States. Instead, you should look into purchasing travel insurance. I've never looked into it, but given that healthcare is significantly cheaper in other countries, the policies are not too expensive. These questions are usually far more complex than they need to be, so much that I make a living out of it. That's healthcare in the United States for you. Hi all, I'm also looking to leave my employer this year. But instead of being an under 30 single, I'm a 40-year-old family guy with a wife and 2 kids to see to. One of my kids suffers from OCD, the other has mild anxiety, and so both need some special attention. Our health insurance does a so-so job of covering this today. It's always. Then of course there will always be dental and vision stuff. Thanks for chiming in on this thread. Can you make a recommendation that is more appropriate to my situation? At the minimum, I can continue with my employer's plan under COBRA. I believe that's an option even if you chose to end employment yourself, and it will come out around $1,000 a month, I think. But after the 18-month period is up, we'll need something else, hopefully sooner, considering cost. Thanks in advance. Hopefully this will be helpful to someone else too. So again, I operate in the more traditional healthcare space and I'm ignorant of new alternative solutions such as Medishare plans or some system of direct provider contracting. But I would say stay away from them if you want comprehensive, reliable coverage. Especially true in your case, as a man with a family who actually uses their health coverage as opposed to a younger guy who never sees a doctor and just needs catastrophic coverage. You'll want to avoid plans that do not provide minimum essential coverage, i.e. plans that do not provide the full spectrum of health services you'd expect out of a health plan like mental health, inpatient or outpatient care, RX, etc. Thus, this really only leaves you with 2 reliable options, 1 COBRA through your employer and 2 federal or state marketplace coverage. There are also public plans available, for example Medicare, Medicaid, TRICARE, etc., but I assume you and your family do not qualify for any of those? I'm also assuming that other employer-sponsored coverage is not attainable through you or your spouse. The choice between COBRA and marketplace coverage is contingent on each individual's situation. Depending on your income, you may qualify for a subsidy when purchasing marketplace coverage, which may or may not render it more affordable than COBRA coverage. But I'll say that without a subsidy, these plans are pretty expensive in my location. You're right that COBRA must be offered to you whenever you terminate employment and lose health care coverage as a result, whether the termination was voluntary or not. It typically lasts only 18 months, though it can be extended for your spouse or dependents in certain circumstances up to 29 months, because COBRA is designed to be a temporary solution until you find your next source of healthcare coverage. Therefore, if you're looking for something long-term, Marketplace might be your only option in absence of you or your spouse getting coverage through another employer or public health coverage. One thing to note about COBRA is that due to the pandemic, most but not all plans or insurers are required to extend COBRA deadlines. This means that you can technically hold off on electing paying for COBRA until 60 days after the end of this national emergency period. So if you don't have any immediate healthcare needs, you could go months without paying premium, and then elect COBRA when you actually need the coverage up until 60 days after the government announces the end of the national emergency. If you're a younger, healthy person who doesn't need to see a doctor or get prescriptions filled anytime soon, and you just lost employer coverage, consider going bare for as long as you can. But make sure your health plan is complying with these deadline extension regulations. Not all employers are required to do so. Ask your benefits or HR staff or insurance company. Note there may be a COBRA subsidy coming shortly in the stimulus bill being debated by Congress right now. Since many people are losing their jobs and coverage, the feds may be providing some relief. Keep an eye on that. This is a good thing to know about COBRA regardless of the pandemic. In normal circumstances, you have 60 days to elect COBRA from the date you lose employer insurance, and then a 45-day grace period to pay the first month's premium. So you technically have 105 days that you can go bare without coverage if you're a healthy person with no short-term healthcare needs. Defer your COBRA election as long as possible if you find yourself terminated or resigning or retiring from employment. Wow, thanks so much for this awesome, above and beyond reply. I really appreciate it, and I'll be able to action on the info this coming January, my planned quitting month. I trust others who are more similar to me will find it helpful as well. I went through a lot of this, just trying to reduce premiums, and also because my situation changes sometimes and I like to be informed. Anyways, the only options I ever was able to find for someone that makes money was: 1. Medishare type plans, religious or not; 2. Marketplace or Obamacare type plans; 3. Private insurance, basically catastrophic; 4. Insurance from a job; 5. COBRA, if you had a job and lost it; 6. Travel insurance, travel health insurance, if you travel outside the US; 7. Direct provider, you pay a doctor a monthly fee, although this is hard to find. 8. Medicare, Medicaid or CHIPS or Medi-Cal, you have to have some special qualifications to get into these, so if you are not traveling, didn't just lose a job, make enough to not qualify for help or assistance, and trying to go on your own, the only real options are: 1. Medishare; 2. Marketplace; 3. Private plan. I would have gone Medishare myself, but right before I elected into it my wife had a colonoscopy and we found a polyp. A large one. That was enough to keep me on my Marketplace plan. A private catastrophic was looked into with some riders, but it was damn fishy. I ended up passing on it. It was like between Medishare and Marketplace for my specific situation. If I was single or married with no health issues, I'd prob do Medishare though. The private catastrophic can be good too actually, depends on plan and the riders you get. One tip though, buy for the Marketplace coverage. Meaning, you buy into the insurance for the discount they provide, not really what they cover. I'll give you an example, making some numbers up here, but this actually happened to me. My wife went in and did her colonoscopy. This was fully paid for as routine. They found the polyp and scheduled her back again after a sample was taken to have it removed. The lab that did the testing on the sample was not fully covered. The removal of the polyp was not fully covered. The anesthesia was not covered. But we paid almost nothing for it all. Not because the insurance covered it, But because what the doctors charge and what they contractually get paid are two different prices. They might have charged us $12,000, but contractually they were only going to get paid $800 total for everything. The insurance paid 80% of that, which left us only paying $160. That's what's important about insurance. The discount in the network. Not what they pay or cover, although that is a huge help too. Couldn't a bunch of entrepreneurs throw together and form a group and bargain for a health plan that way? Or would that sort of be moot since the employer usually pays the lion's share of the cost? He was thinking even if you were still looking at $500+ a month per person, just having hundreds of people grouped together would make it a juicy enough sale for a decent discount from a bigger carrier than what the normal marketplace offers. Not to rip this, but there are some misstatements here. I'm sure you're an intelligent person, so this just displays how ignorant the majority of educated people are about how healthcare operates in this country. I'm an expert and I still struggle sometimes as a healthcare consumer. I'm not sure what you mean by you absolutely do buy coverage for what it pays or covers, because coverage is technically synonymous with discounts. For example, if your plan completely excludes coverage of acupuncture, you are getting a 0% discount on the provider's billed charge for that service from your insurance plan. If your plan provides 80% coverage of acupuncture in their network, you are getting an 80% discount on the price the insurer negotiated with the in-network provider, called the allowed charge. So using your example, the doctors have a certain list price of some unknown amount for those services called a billed charge. However, because you used providers doctors contracted with your marketplace insurance plan's network, those doctors are only to bill you a negotiated amount of $12,000 for those service called an allowed charge. Your plan then provides 80% of those services, meaning they apply an 80% of that allowed charge. So, the combo of labs, polyp removal, and anesthesia may have a list price of say $30,000 by those providers. This number can be anything the providers want, because this is how the US healthcare economy works. Then the insurer negotiates an of $12,000. Because the plan provides 80% coverage discount of that allowed charge, it results in total of $800 to you. However, if your plan did not provide coverage of polyps or anesthesia or labs, then you could be hit with that $30,000 bill charge by the provider. And this is why marketplace coverage as well as COBRA coverage are the ideal options for those who actually need some degree of healthcare. As I explained in my other response, these forms of coverage provide minimum essential coverage, meaning that they provide coverage for the full spectrum of health services you'd expect out of a health plan, like mental health, inpatient or outpatient care, RX, etc., at or above a certain actuarial value. You basically made my point. Not sure where you thought you were ripping me. Doctor bills $30,000. But in my example discount there is a discount since you are under X plan and the doctor is only allowed to collect say, $4,000. Then the insurance pays 80% of $4,000 and I pay 20% of $4K. In what I present above, I pay only $800. Why? The largest chunk was discounted, like I said above. The why in buying the insurance. I go to same doctor and they bill $30,000 with no discount. I'm stuck paying $30,000. Let's say some insurance covers or pays 80% and I pay 20%, I'm paying 20% of $30,000, which is $6,000. So yes, you buy insurance 110% for the discount, not what they pay. What they pay is basically icing on the cake, as I'd rather pay 100% of a huge discount, than 20% of little or no discount, depending how the math works out. Even me paying 100% of the discount in my example, $30,000 to $4,000, and me paying 100% of the $4,000 is still less than me paying the $6,000 example above. Yes, this is already being done if I'm understanding you correctly. Small businesses who share some type of commonality, for example profession, line of business, geographical location, can pool together to form an association health plan AHP to get the savings of large group medical coverage rates for their employees. But if by entrepreneurs you mean some self-employed people to form a group health plan for other self-employed people to join, it's not clear to what extent that can be done right now. The Trump administration attempted to expand the types of groups that could form an AHP with newer Department of Labor rule, including expanding the definition to allow self-employed individuals with no employees to form AHPs. The rule also removed the commonality of interest requirement, as well as avoid some Obamacare coverage requirements. However, a federal appellate court blocked the rule from going into effect. But a bunch of states are ignoring the court ruling, so it's a mess. Okay, when you say there is a discount, you mean there is a negotiated price between the insurer and the doctor, called the of the insurer for a given service. Aetna can contract with a doctor who bills $30,000 for a service and say, we are only going to reimburse you $4,000 for this service. Then the plan charges you 20% of the allowed charge of $4,000, resulting in $800 out-of-pocket cost sharing to you. This is where you are misunderstood because you don't understand how the healthcare economy works. The bill charge for the exact same hip surgery on the exact same patient can range anywhere from $15,000 to $70,000 in Dallas, the same procedure. Why? Because private healthcare prices set by providers are imaginary and are based on nothing in the US. Therefore, you don't buy health insurance based on the discounts negotiated between insurers and providers as you're suggesting. You buy healthcare based on the monthly premium or cost sharing 80% or 20% that the insurance charges you for comprehensive health coverage. The negotiated rate between providers and insurers factors into your buying decision because a doctor can charge $15,000 for a hip surgery, and an insurer negotiates down to $10,000 and covers the surgery at 80%, resulting in charge to the patient. Or another doctor can charge $50,000 for a hip surgery, and that same insurer negotiates it down to $5,000 but only covers the surgery at 50%, resulting in charge to the patient. The discounted or negotiated bill charge between provider and insurer means nothing. All that matters is how much you pay out of pocket per month in relation to the level of coverage you receive in return. Period. You can't get your terms straight, so it's difficult to even correct you. K. Not true. I don't need to know the wording, the process, the intimate details of how something works or is set up. Just like a business owner doesn't need to understand finely tuned details of Google AdWords and the algo and other processes. They just need to know, is this helping my business or not? They and myself just need to understand money in and money out. Money is what matters in the end, besides care, quality of care in a medical situation, which we are not talking about here. However, I have been buying insurance for decades. I also worked in healthcare Humana in Louisville, Kentucky, and I have been under group plans and also bought my own plans way before Obamacare. I've shopped around a lot. I've paid a ton of money. I've reviewed a lot of plans. Money in and money out. If Aetna provides better allowed charges the discount than Humana, the price I pay for the premium or percent covered is almost second thought. Depending on the allowed charges, again the discount which sets the base price, the premium or percent I pay could either be great or horrible. The base price sets the foundation. The base price comes from the allowed charges or discount that was negotiated. The premium and percent influence past that, and that influence could be tiny or nothing at all. Hence see my examples again above on $30,000 procedure. It's logic like yours that as common people in the shithole they are in when it comes to healthcare and healthcare pricing, They think about the upfront costs like premium and percent, not what influences the pricing to begin with, the allowed charges, which is basically the discount the network provides. Everyone runs to see what their premium is. Everyone runs to see what their doctor visit is or their percent in network after deductible. All of that is shit if the allowed charge is again the discount, is null. It's math in and math out. Very simple. I am trying to navigate this right now. I am covered by an employer, but I don't do much work for them anymore, so they want me to secure my own coverage. The plan I have with them costs me like $800 or more for my family for a very good plan. The closest to the same benefits I can find in the open market are around $2,600 or more. This is fin crazy and is making me reconsider if I should just do the bare minimum few hours or week for my employer to maintain my existing health coverage. So how do you account for this when shopping for coverage? Perhaps the problem is that you're ignorant of even the basics. It's one thing to overcomplicate something to the point where it provides no benefit to your understanding. It's another thing to dumb down something out of ignorance in an attempt to convince yourself that you understand it. The healthcare simply economy does not follow the basic supply and demand principles you learned in Econ 101. Throw everything out the window when it comes to pricing of healthcare goods and services. Look, I'm not an expert in most things. But I called myself an expert in health coverage because I am one. I am a niche health benefits attorney with almost a decade of experience reviewing insurance plan documents and provider contracts. Not only do I review plans, I draft the plan documents and their reimbursement terms. This is what I do for a living. And this statement alone shows your ignorance. Do you understand that these reimbursement rates are proprietary? So even if you wanted to know what the base price is for a service, you wouldn't be able to know? You also realize that Aetna negotiates reimbursement rates with each individual provider for each individual service? So tell me, how do you obtain the fee schedule of payments between providers and insurers to make this evaluation on which insurer provides better discounts on a whole across all providers for all services? You don't, and you're pretending like you somehow do, which is comedic. What if Aetna negotiated excellent reimbursement rates for outpatient surgery but terrible ones for physical therapy? Which insurer is better there? When people use information that is actually available to them, i.e. upfront costs rather than the imaginary analysis you're pulling out of your asses when people have any hope of getting value out of their healthcare. Pretending like you know what you're talking about when you don't is how you leave people confused in threads. When determining health coverage to purchase, the main question is 1. How much health coverage do I need, and 2. What plan will help me reduce my out-of-pocket costs the most? You need to look at 1. The range of services covered and the level of coverage for each service, 2. The cost-sharing split between patient and insurer, i.e. co-pays and co-insurance for a given service, and 3. The overall monthly premium. Not much more should be going into the average person's analysis. Absolute ignorance. I'm not going to respond to anything further you say at this point. Depending on which employer you work for, employer-provided coverage is commonly less expensive than any plan you'd find on the individual market because the employer subsidizes a portion of the premiums as an employment benefit. So I would say if there's any way to hang on to your employer coverage while still pursuing your entrepreneurial goals, then definitely do that. You just don't. You estimate what your health needs are going to be and then shop for a plan based on the combination of monthly premiums, scope of coverage of services, i.e. what types of services are covered, and level of coverage, i.e. how much does the plan pay after you met your deductible or co-pays. Fine, I don't have to be right. Seems you try very hard to though. Here is what I do know. You say I wouldn't know the fee schedules ahead of time. Wrong. I've called my doctor before to find out typically what they charge for X procedure and then have called my insurance human to find out if procedure was covered. When told yes, I was also told what I was going to pay or owe as breakdown. If the doctor's office told me the fee is typically $500 for this procedure, and the insurance tells me I will owe $40, this was not an office visit. 20% of the $500 is $100. So there is discount I can calculate to figure out how the insurance got to $40 that I will owe. It's math. Of note, I've been able to call other insurance networks and do the same while shopping. I've done this with 2 other networks in the past month. Over the last decade I've done it with more that I didn't bother to count, as I didn't know I would have to prove something like this on a forum. While I cannot call every provider about every possible procedure on this green earth, I can very well call about the medical conditions my family has routinely and ask about those and get a general idea of where things are laid out. Money in and money out. So please tell me again, with your drafting plan expertise, how I was able to pull this off. And no, drafting documents does not equal knowing or not knowing how to figure out discounts or allowed rates on the consumer end. Have a nice day. Yay. We know you don't like to read. Like I said, I'm not going to waste my time pointing out the ignorance in every single one of your responses. You just keep making yourself look dumber and dumber in front of anyone who has any knowledge on the topic. Apparently you've single-handedly figured out the solution to one of the most elusive problems in the US healthcare industry. I'm just a health benefits attorney who literally specializes in plan or provider payment and reimbursement and represented consumers or patients in claim appeals, but WTF do I know? Maybe I should quit my job. Healthcare is easy, just money in, money out. Duh. Everyone listen to this guy. He's the real guru. I was just trolling all of you apparently. He's probably an expert in investing too. It's just money in, money out. Easy. Who needs advice? Nuclear physics? Probably just money in, money out. Actuarial science. Oh yay, money in, money out. Stupid actuaries. Stupid lawyers. Stupid everyone. Money in, money out. Tip on how to be an expert: be humble. I know a fair amount about developing software. To some people, I'm an expert. I certainly charge a fair amount for my time when my team and I develop software for a client. However, do I know everything? Nope. It's not possible to know everything. Besides that, there are different schools of thought on the best way to develop software. Netflix, for example, hires the absolute best developers they can find, and pays the hundreds of thousands of dollars a year to each of them. They figure that doing that, they save on management costs because they don't need as many developers. Other companies rely on the system of software development they've created to manage their projects effectively. They hire more developers and pay them less. Which way of thinking is correct? Beyond that, which language, hardware, project management methodology is best? Who knows? You act like you know everything about health insurance and illiquid brings nothing to the discussion. Even if you were 100% right in this situation, the fact that you have that attitude makes me, your audience, suspect that you don't know as much as you think you know. It's not possible to know everything about the insurance industry. There are different laws state to state, and each person brings a unique combination of needs with them as well. Illiquid brings some pretty deep business experience to the table. I'm betting that he's at least partly right. You, as an expert, would be more convincing if you acknowledged what he's right about. Honest question. Did you read the entire progression of this thread to see how I responded from the beginning? You don't need to lecture me on humility. I started my response to this guy with the following: I don't know everything about healthcare. Nobody does. But I am at the very least solid on the basics. His fundamental understanding of how the healthcare economy works is misguided, and I attempted to correct that several times. Instead of engaging in Socratic dialogue, he retorts and says I'm flat out wrong. And at that point, my humility flew out the window. If I come to you and say, when it comes to software programming, HTML is all you need to know. The rest of the languages are pretty obsolete. Would you even entertain a discussion with me on evaluating different programming languages with that level of ignorance? And then if you take the time to enlighten me, but I still stand my ground and say you're wrong because it's actually simpler than you think, then you get what this thread devolved to. If someone said, HTML is all you need to know, I'd ask, why do you say that? The reason for that is that they probably have a perfectly valid reason for that statement, and it might be something I hadn't considered before. They also probably have a misunderstanding about something somewhere. If I can figure out what that is, I can help them out. The net of it is that we both benefit from the conversation. Here's what humility looks like. I can learn from each person I come across. I'm really good at a few things, and I know what those are. When someone disagrees with me, I can discuss things with them without being offensive or taking offense. I have a good sense for when I don't have the entire picture of something. I can take people's feedback and not get defensive. I can listen to feedback and take the good but leave the bad. Did you read the thread? I honestly don't think you did, and just looked at my last comment and made an assumption about the rest of my behavior. Your comments should be directed towards him, not me. He had a misunderstanding, and I respectfully and carefully broke down in an explanation why it was wrong. He retorts with the following: "Yay, I'm not going to act like Buddha when someone acts smug like that. I don't give respect to people who don't reciprocate it. I read every word. Best of luck to you." I think there's a fine line between having humility and being critically unassertive and unconfident. It took me many years to speak with conviction. I was often told I was too humble, too meek, too conciliatory. I understand that putting aside your ego can win you respect. I've internalized. However, I also have learned that being assertive in discussions, while it can be polarizing, is also a way to win respect. When you are confident in yourself and what you say, others absorb that energy and follow you. I'm a big fan of Greg Doucette, a pro bodybuilder who unabashedly calls people who claim to be dieting experts idiots when they say something stupid and proceeds to break down their statements are stupid. For example, people have respect for this guy because while he's polarizing, he backs up his assertions and dismantles false facts or logic to battle spread of misinformation. He does not bash his viewers or people coming to learn from him except to be funny. He destroys people who claim to be knowledgeable yet spew absolute misinformation that contradicts what he knows as an expert. Pro bodybuilder. So yay, I know I'm polarizing. I'm purposefully not practicing humility on the one topic I'm an expert on and understand far better than the average consumer. I should mention I know a lot about SaaS too, since I've been using Dropbox and iCloud since 2012. It's all bogus. Computers these days have huge hard drives that hold terabytes of data, but everyone's all hyped up about this totally hackable and unsecure technology that does the same thing as a physical hard drive. Data storage means nothing if it's just going to be hacked. People don't focus enough on reliable physical security and instead go towards whatever shiny tech thing is out there. It's just data in, data out. Why complicated? The fundamental misunderstanding by illiquid is the fact that in the United States, we have these large middlemen occupying the healthcare market called insurers. Consumers, if insured, purchase healthcare directly from suppliers, providers or doctors. Rather, insurers come in between suppliers and consumers to muddle the way the exchange of goods typically operate in an economy. Insurance companies as well as employers who self-insure their plans are called payers because their job is to pay for your healthcare in exchange for a monthly premium from their customers. If insurers do things right, then they are paying less for your healthcare than they are collecting in monthly premiums, thereby making a profit. Thus, it is in the insurer's interest to pay the least amount of money for your healthcare as they can. One way insurers accomplish this is by negotiating discounts with providers, because the less they pay your doctors for a given service, the more profit they make off you from that service. Insurers then hire these very smart people called actuaries who crunch numbers and determine how much to charge you, the consumer, for those goods or services through monthly premiums and cost-sharing deductibles, co-pays, and coinsurance, and still turn a profit. A doctor charges $50,000 for a hip replacement surgery there. Aetna negotiates that price down to pay the provider a maximum of for that surgery in exchange for including them in their network and driving Aetna members to them. Aetna's actuaries determine that by charging you in the forms of a premium of $200 or more plus $5,000 deductible and paying 50% of the cost of the surgery after the deductible, they will turn a profit. So with this Aetna plan, you'll pay at least that year in out-of-pocket costs for healthcare $2,400 in premiums plus $5,000 deductibles plus 50% of $20,000 surgery. Same doctor charges $50,000 for a hip replacement surgery. This time Cigna negotiates that price down a maximum allowed charge of only for that surgery. Cigna's actuaries determine that by charging you a premium of $400 or more plus $2,500 deductible plus imposes a $500 co-payment on the member per surgery, they will turn a profit. So with this Cigna plan, you'll pay around that year in out-of-pocket costs for healthcare $4,800 in premiums plus $2,500 deductible, and $500 co-payment. So which plan are you choosing? Hopefully the one with better allowed charges, negotiated discounts. As you can see from the diagram, you pay premiums to the insurer and share the cost of the service with the insurer either through co-payments or coinsurance. As explained in the scenarios, actuaries are the ones setting the premiums and co-payments, or coinsurer, the provider or doctor or supplier. The same is true with public plans like Medicare, except it's the government's actuaries negotiating or establishing the rates with providers rather than private insurers. And that is why comments like these are simply, when you're picking a grocery store to shop at, are you looking at which grocer buys food from distributors at the best rates? Of course not. You're just looking at the upfront cost of food on the shelves because that's what impacts your wallet. If Costco buys chicken at $1 or pound and sells it to you for $6 or pound, but Sam's Club buys chicken at $2 or pound and sells it to you for $4 or pound, where are you shopping? Sam's Club is fine with making less profit for whatever reason, so you buy their cheap price. You don't care that they paid more for the good. There's a reason everyone runs to see what their co-payments and coinsurance is on plans. It's because it's the price tag on the shelf. Just because the masses do something, doesn't mean they're idiots. Sometimes it's because it's the most logical thing to do. Now let's break down why what you're doing here directly contradicts your statement that you call the doctor's office and obtain the procedure code CPT code that they would bill your insurance network for a given procedure, and the doctor says they bill $500 for the procedure. You then call Aetna and they say that for CPT code 012345, you will owe only under their PPO plan after paying your cost share of. And so when you do the math, you figure out that the allowed charge for CPT code 012345 by Aetna is, where Aetna pays $160 and you pay $40. Cool. Now you call Cigna. Cigna says that for that same CPT code 012345, you will owe after paying your share of. When you do the math, you figure out that Cigna actually negotiated a better discount for CPT code 012345, they're paying the doctor. But they stick you with a 50% cost-sharing price tag, leaving you with $75 in out-of-pocket costs. Plus, you're not even taking into account a multitude of other factors, most importantly plan deductibles. What if an insurer negotiates great discounts but they impose a $10,000 deductible before they cover any bills? Or what if this is a co-payment plan, where you pay a flat fee for every service rather than a percentage cost sharing? Who cares what the allowed charge is when you're paying a flat fee for a service rather than a percentage of the allowed charge? Co-payment plans are quite common too, though not so much on the individual market. So your own example illustrates how insurer cost sharing and total out-of-pocket costs are the only important factors in your analysis of shopping between plans. Sorry to hear you've been spinning your wheels for nothing for so many years. The best thing you can do is request a summary of benefits and coverage SBC for each plan you're interested in purchasing and do an analysis of the cost sharing, taking into account the relationship between premiums, deductibles, cost sharing, and your overall healthcare coverage needs. This is all that is required of a wise consumer to make good purchasing choices in the health insurance market. Focus on total plan out-of-pocket costs, not negotiated discounts, when you are shopping for health insurance, and basically ignore everything the liquid said and you're solid. Your ignorance on this topic really makes me wonder what law school you went to, but considering you get paid to push health insurance, I guess I shouldn't expect more from you when it comes to helping consumers save more. There are plenty of people in this country with similar printed out papers or degrees and hefty debt bills. But that doesn't mean they are smart or experts. Same with people that work a job for X years. Working a certain job on a topic doesn't make you an expert or smart. You like to push your own attorney. So what? I know about 100 attorneys personally that specialize in tax. Some are very good at what they do, some are very bad. All have a degree and have been doing it for X years. I am not going to trust the bad ones, just cause they say they are an attorney and went to school and did this as a job. And I for sure wouldn't trust any that start out talking about how ignorant people are, like you have done in this thread within the first few sentences of your post. A complete lack of respect just shows how high up on your horse you think you are and how much you think you need to be right. I mean, you even posted about some bodybuilder and how he has to be right and how you emulate that. Kinda sad because you can be confident and wrong at the same time. I guess you haven't learned that. All your examples take into account only examples where the allowed charges are low, but out of pocket to consumer high. I never once said the total owe up to the consumer wasn't important. In my examples I broke down the end cost to the consumer. You seem to forget that. Money in, money out accounts for that final owe up. You act as though I didn't. As common sense, no one is going to take a plan where they knowing pay more in the end. Keyword here is the knowing part. Most people don't know they are paying more because they don't shop around. The fact is people typically pick insurance on these things. This is where it generally stops for most Americans and most middle-class people. You aren't going to out-argue me on this. Most shop on this alone, because this is all that is offered to them. Day jobs typically have one insurance provider and several states on the exchanges only have one option or provider as well. Typically there are not multiple choices for the average American, so they don't tend to shop around. They have been trained to just look at the three numbers above without actually knowing the final total cost, since they can't shop around most times. But none of those three variables matters, right, if the allowed costs is 100%. Why pick a plan where the premium is $200 a month, the deductible is $1,000 for a single person, and the coinsurance is 20% if there is no discount on the allowed cost? This plan is only good or bad once you measure the allowed cost discount. At that point you find out what your true owe up is for the year potentially. Without it, you're sinking in a shithole. Insurance is about compensation for specified loss, damage, illness, or death in return for payment of a premium. Great, so how much will the consumer be out for that premium though? You can't know that without knowing the allowed cost too. Knowing I owe $200 a month plus $1,000 deductible plus 20% of XXXX number doesn't mean shit to anyone if they don't know what the base price, the XXXX number, the allowed charge, The discount is .xxxx could be anything. You can't do math on XXXX guessing game numbers. You need to know the price. You only know this once you know the allowed charge or how much of a discount you are getting. And there can be better discounts had by shopping around and calling and comparing that to what you pay up to see if things make sense for you as a total outcome. Once you know the allowed charge or discount, then those numbers actually make sense to a person. When you review your medical history and what kind of procedures you have yearly or expect to, then you can actually crunch numbers yourself by calling the insurance company and actually find out if this insurance is right for you financially. Otherwise you end up like most Americans, in a shithole based on the same logic you, and attorneys like you, are spewing out. Knowing the allowed charge, or network discount by calling and asking about X procedures is the only way to know the true price. This is how you figure out the cost. The only time you don't potentially need to know this for most Americans, is if your plan says your routine visit is covered 100% or that your doctor visit to your primary is $30. But that's because you know the final outcome already in both options. Otherwise, when you are left in a co-insurance situation or pre-deductible situation, you don't know what it is you are paying because you don't know the allowed charge or discount. This is where you get screwed unless you know the numbers. Which is what I have been advocating here in this thread. Money in, money out. Learn your numbers, folks, when it comes to what you are paying out and what insurance provides a better discount for your premium, co-insurance, and deductible. You can't plan for the unexpected though, so plan for what's routine for you and your family and pick the better option for you financially where you can still see the doctors you want. Don't blindly pay if you don't have to. If you think I'm advocating learning the allowed charge or discount so that you can pay more in the end, the final total outcome, you sir are highly ignorant and never once read any of my post in this thread. Laughable. These people work for the insurance companies, not the end consumers. These people do not help consumers save money, they help insurance companies make money. Not sure why this is even brought up. These people are not working in the consumer's favor. This thread is about helping the end user or consumer. These actuaries do not do that. They get paid to help the insurance company make more money, not help a consumer pick the right plan for them. Easy example, two competing insurers have exactly the same premium, costs, and benefits for identical coverage plans. You have surgery to repair a torn muscle. Provider bills $10,000 for the operation. Insurer allows $7,000 charge for the operation. Insurer B allows $3,000 charge for the operation. Which insurer is better for the consumer? Obviously you will pay less with insurer B, but how can you know this in advance? It is critical information when shopping for coverage. Yes, you got to call the insurance companies and ask. Tell them you are looking into options for coverage and you are curious. Start with the one you have coverage with now. For me, that would be Humana. Tell them you use this doctor specifically or this hospital or group. See if they are in the network. Tell them you need this type of care, or this procedure done, or that you get this type of shot every 3 months. Then find out what the cost is going to be that you are responsible for. Write that down. Call the doctor. Find out what it's going to cost for your procedure you need. Granted, something like a surgery is going to be complex. There might be multiple charges coming out of that. That is not just your doctor's portion. This is why I said earlier you won't be able to prepare for the unexpected in this and call on all things all the time. It is also why I said to call about what's routine and what you expect to happen so you can get some info. For example, my kids get allergy shots all the time. My wife has a special procedure done every year for polyps she has to have done. We always seem to have other particular issues as well that crop up every year or every other year, such as my wife seems to get bone spurs in her heels every couple of years. I don't want to get into medical conditions here, but you see my example, right? You're gonna call on all of that. not stuff that might be one surgeon, an anesthesiologist, supplies, a hospital stay, etc. that's going to be complex for you to figure out. Maybe not. I am not sure what surgery you might be getting and what they do with torn muscles. But you can call on at least maybe the surgeon's price and something else and roughly figure out some of it ahead of time. If you have talked to your doctor about this and he recommended surgery and you have seen the surgeon, you can call them and their billing staff and find out what the charges would be for your procedure. They cannot give you a 100% answer though, anything could come up in the surgery of course. But at least you will have an idea to start with and some information to use in your research, right? Thank you for making a helpful comment that actually furthers the discussion. Let's break this one down. You do obviously pay less with Insurer B. If we're assuming these are coinsurance plans where you share a portion of the allowed charge, then yes, potentially. If these are co-payment plan designs, then allowed charge isn't even a consideration. But yes, you're correct. When shopping for health insurance, the last variable to worry about is the allowed charge. However, once again, the point of this entire discussion, and how this entire argument with illiquids started in the first place is because I bothered to correct these brain-dead statements. It really should be the reverse. It should be, dumb people who are confused and pretend to know what they are talking about focus on the allowed charge negotiated discount when shopping. The allowed charge is totally irrelevant when premiums, deductibles, and coinsurance or co-payments are shit. Again, yes, you remove the most important variables, and maybe allowed charge becomes relevant. This thread is about helping people choose the best health insurance options. Do not focus on things that don't matter and are ultimately out of your control anyways. You're also correct that you cannot know this information in advance, or really at any time at all. This information is most of the time protected as proprietary. It was just last year that the Trump admin issued an executive order requiring hospitals to disclose their charge master list of prices that they bill. It's 2019. There is little to no cost-price transparency in the healthcare market. This is a big consumer problem and everyone in the industry knows it. This is why you cannot actually do what the idiot arguing with me is telling you to do. Now Medicare sets a master fee schedule of rates that insurance companies as a baseline and determine allowed charges. You could think of this as the baseline for where healthcare pricing starts. However, it means nothing for consumers. For example, Medicare has an allowed charge of something like $150 per ambulance ride. However, for that same exact ambulance ride, an Aetna plan might reimburse $2,000 and Cigna reimburses $3,000. And yes, the price disparities between public and private insurance are indeed that significant. This is why there's really no such thing as price in the healthcare market. Insurers distort the real price of healthcare. And I just thought of something that would prove everything he said wrong. Medicare negotiates by far the lowest allowed charges with providers compared to any private health insurance plan. So illiquid's logic, wouldn't that mean Medicare is superior and more cost-effective to consumers than any private plan? It's not. Not even close. Most people have to supplement their Medicare coverage because they have too many out-of-pocket costs due to Medicare's cost-sharing requirements. If we go by illiquid's logic, Medicare is the most cost-effective source of coverage for consumers in the country. But it absolutely is not. Oh, the irony! Out of all the diarrhea that you just spewed in your response, the one thing you didn't do is address your brain-dead comments that started this entire discussion and my carefully explained retorts of them. You just dribble more garbage, presenting it as fact, and confusing the shit out of people. I think at this point, most people can read this thread and make a determination at who is actually providing helpful and well-reasoned information. Half of everything you wrote doesn't even make sense because your writing sucks anyways. Even if you were correct on a point, you don't know how to articulate it. But you're 100% wrong on all your points. If you were right about anything, I'd admit it. I'd swallow my ego. But you're not, and worst of all, you're delusional, so you'll never admit that you are wholly ignorant. This statement alone tells me you have pea brain. You don't even know what I do for work, and you assume that I push health insurance. Lol. I began my career working for a non-profit organization representing consumers in court when they appealed their health claims, and I advised them on the very issues we are discussing today. My current role is also still consumer-facing. I did at one point work for a major health insurance company, and that only served to round out my knowledge further on how the industry truly operates. Man, you really have a lukewarm IQ. No shit that working on a topic doesn't automatically make you an expert or smart, but generally you will know more about that topic than the average person. While there are some tax attorneys who somehow slide by on being bad at their jobs, I guarantee you most seasoned or senior tax attorneys know far more about the tax code than you do. But, knowing you probably ignore their advice, mock their profession, call them pompous, and say it's USTM money in money out. It's so simple. I never brought up that I was an attorney in this thread when giving advice. When I was speaking to normal, non-deranged people, I called myself a health insurance expert specifically to not draw ire from anti-intellectual pragmatists like you who need to simplify life to appease their limited brain capacity. I only presented my credentials when you presented yourself as an expert because you shop for health insurance and are like worked at a healthcare company one time. This is literally the one thing I'm an expert in and spend most of my time learning and advising on. I would not be arguing this adamantly and calling you an idiot on issues like cars, or stocks, or tech, or whatever other topic I don't literally spend 90% of my day focusing on. But you, who shops for coverage to treat his fat wife's bone spurs, tip, it's cheaper to just lose weight. Calories in, calories out, and can't explain a concept to save his life. Yay, people should listen to you. No. This is a forum, and this thread will potentially be read by many people looking for reliable information from experts. I'm trying to prove that you're an idiot and no one should listen to anything you've written so they don't waste their time taking your advice. I really wish there was another expert on health insurance in this thread so they could back me up and attest to how void of fact your responses are. I'm trying to set the record straight and prevent people from coming on this thread and getting confused because you came in and muddied the facts for everyone, and then turned around and called me an idiot saying I don't know what I'm talking about. Unreal. So how about I just post external sources to directly refute your points instead of spinning my wheels and arguing with someone with the deductive skills of a toddler? This one's from the Harvard Business Journal, but let me guess, the professor of medicine at Harvard who wrote this article just has some dumb fancy degree and probably has no idea what he's talking about. You should probably take his job actually. You should take my job. So tell us again, wise one, how you are able to obtain these prices. Oh, you just call up the health insurance company and they tell you the proprietary information? Oh wait, no. You first have to do simple math and to easily figure out their proprietary information. You delude yourself into thinking you're some type of savvy consumer, but you're actually doing what everyone else to shop, with the added benefit of wasting way more time than the average person. Congrats. You are a fool. There's my mic drop. I don't have anything further to add at this point. That should put you in your place. But, I still fully expect you to find a way to undermine this information as well and crown yourself the expert. I would be shocked if you actually admitted you were wrong and admitted that you, as an average consumer and clearly below average IQ, are misunderstood. But at this point, we have jury in the audience of this forum. They can decide for themselves which content to heed. I also encourage anyone who is confused to print or email this thread to a health industry expert, preferably a doctor who understands insurance and billing, and review this information with them. And just for the record, this rat went into his past responses and removed comments like this to make it seem like I was being the a-hole this entire time. Present yourself as an expert and present falsities as facts, then prepared to get shot down. It was only after this comment that I revealed my credentials. Listen, dumbass, didn't get enough attention from mommy when you were 6, so you take it out here on the forum. I removed that comment before you even posted. You happened to read it before I edited, but posted after I edited. Look at the timestamps, idiot. See why I know you don't know what you're talking about? My post with timestamp your post where that comment is included. I removed it not to make you look like an rat, I removed it before you even commented, idiot, to not push this thread into what it is now. You made yourself look like an rat, clown. Geez, you're a moron. It's people like you that cause others to not even want to visit this forum anymore. Money in and money out. You can't change that. All of my examples go into how to get the cheapest total price at the end. You can't seem to get that in your head, because that big ass degree and ego got in the way, like you got some big swinging dick to show off. You're just trying to prove to yourself you're right by posting over and over again. Learn it. Massive news for healthcare consumers. Yesterday the Trump admin finalized a regulation requiring full price transparency in the healthcare market. I'm actually shocked this rule was finalized. For the first time ever, we will hopefully be able to truly see price of healthcare, including negotiated rates between payers and providers. Second, most non-grandfathered group health plans or health insurance issuers offering non-grandfathered health insurance coverage in the individual and group markets will be required to make available to the public, including stakeholders such as consumers, researchers, employers, and third-party developers, 3 separate machine-readable files that include detailed pricing information. The first file. The second file will show both their historical payments must have a minimum of 20 entries in order to protect consumer privacy. And finally, the third file will. Plans and issuers will display these data files in a standardized format and will provide monthly updates. This data will provide opportunities for detailed research studies, data analysis, and offer third-party developers and innovators the ability to create private sector solutions to help drive additional price comparison and consumerism in the healthcare market. This will affect all of us, whether you obtain coverage through an employer plan, the individual market, a public plan, or even if you're uninsured. I used to absolutely hate anything that had to do with insurance. Now looking back, it was mostly because I had an awful plan and I just couldn't seem to get myself out of that situation. Leaving the employer that I had worked for the past couple of years was finally my chance to look elsewhere, and now the best advice I have to give from all that experience is to go and sit down with professionals that can guide you through the maze that are insurances. I ended up going with, and I learned not to have such a hate on them anymore. It's definitely worth looking in a lot of different places. Quick FYI update from me. I am now officially outside of the W-2 sphere and have signed up for an insurance plan. For a family of 4, the current premium is about $1,200 monthly, $450 we have a tax credit for. As my business becomes more profitable, that credit will erode, but it is what it is.